Dr. Buford here. I'm the director at the Dallas PRP and Stem Cell Institute, and we're about to do a My Eye procedure on the left knee. This is a procedure that we're doing as a follow-up because this patient had an osteochondral defect on the medial facet of his patella, and we did a microfracture and used bone marrow concentrate as a source of stem cells to try and promote some healing of the osteochondral defect on the undersurface of his patella. And so that procedure was about 3 months ago. And now we're going to use the My Eye to see if there's been any progress in terms of healing of that medial osteochondral defect. So we've got his demographic information in. This tablet is not only a in-office disposable needle arthroscopy tablet, it also has an ultrasound transducer combined with it. There's either a linear or a curved transducer available, so not only can we use this to do our needle arthroscopy, which is what we're about to show, but we can also use this to diagnose soft tissue injuries by using the ultrasound feature of the exact same tablet. So it's kind of a two-in-one device. It's unique on the market in that respect, and that's why we like using it. So I'm going to go ahead and hit the button here. We're going to connect the My Eye in just a second here. But you can see on the screen at the top we have an option for the My Eye, which is the disposable needle arthroscopy. And then below we have the My Ultra, which would be the ultrasound transducer. So from this one tablet, we have two imaging choices, both intra-articular and extra-articular. So now we've already numbed up both medial and lateral parapatellar portals. We're going to go ahead and connect the My Eye in just a second here. Okay, so here's the scope device. It's a very small, disposable needle arthroscopy unit, has built-in fiber optics so we can visualize on the tablet. So the next step is we're going to go ahead and enter the knee. Is that right? Okay. Okay, we're going to stay a little bit lateral. You feel me touch there? Mm-hmm. Okay, a little poke right here. Okay, we'll take a little bit of normal saline that connects here. Okay, so there we are into the knee. That's the medial compartment, so that's medial meniscus on the left, medial femoral condyle up above, and medial tibial plateau down below. We'll start to slowly work our way up towards the patella. And this is the region where we did the microfracture before. I'll get all the way to the midpoint of the trochlea. And that's exactly where we did the microfracture, right at the top of the screen. Now we've only injected, I guess, about 20 cc's of fluid, so this is not a procedure that requires a lot of normal saline to see. What I am going to do is have my assistant extend the knee, so slowly extend the knee. And you just try and relax your knee completely, okay? And I really don't see anything else to worry about there. Flex back down and just let the knee relax. And again, this is the region where the defect was. Let's flex the knee a little bit more. Push down. Keep going. Okay, I'm going to take a little more water. This is a 0-degree scope, so that's why you don't see the normal reticle you see on a typical arthroscope. So we're basically looking directly at what's in front of the scope. There's no offset. There's no 30 or 70 degree offset on this in-office needle scope. The field of view, I believe, is 120 degrees, so that's why we have such a great image. We have a very wide field of view. It's an autofocus type system, so that we don't have to worry about a focus ring or anything else. We just adjust our distance. So there's the area that we were working on, I think right there at the middle of the screen. And that sure looks pretty good. Flushing a little water through. This is the medial gutter. No problems here. And then we get back to this medial facet where we had the OCD, and that's where it was right there. That looks pretty good. Can you feel me touch you here, buddy? Does that feel pretty numb?
I can feel it.
You feel that right there? Okay. So I've got this spinal needle coming in, as you see here. And we're just trying to probe this area. Okay, so it's still a little bit unstable, I guess you would say. So that's what we're seeing there. That's better than what we had. It's still obviously not normal articular cartilage, but at least now in the office we have a way to track the result and track the response. And that's what we were trying to demonstrate here. So okay, so I think we'll finish up here. And we're going to have a chat with our patient and his family. But I think this is a nice demonstration of how we can use the MyEye to assess cartilage lesions. You can imagine if we had a medial femoral condyle lesion, it would be very easy to see it and document the healing process. In a very similar fashion, we can see the lateral aspect of the trochlea. So we get a very good image of the knee. We can come all the way down to the front. There's the anterior cruciate ligament. So we get a very good image of the ACL. We can use it to document or to guide intra-articular ACL injections. And we can even see the lateral compartment, which we don't need to see today. But there's a good look at the ACL. Okay, thank you very much.